So, if you are a psychotherapist or clinician of some kind, but especially a hypnotherapist, and especially if you work with cognitive approaches and cognitive restructuring in particular, then of course you'd be well advised to ensure that you were aware of the functioning of the amygdala. And this, as I've been saying, that this area of the brain is designed to detect danger. It evaluates and processes information long before that information is going to be consciously processed. So, information comes up the spinal cord, comes to the thalamus, arrives at the amygdala first. And if the amygdala determines it's not a threat, that all is okay, then it's going to stay at its baseline level, whatever that may be for that individual. If the amygdala perceives some sort of threat or danger, it's going to activate. And when the amygdala it sends strong signals to the upper areas of the brain to actually shut them down. The amygdala hijacks the brain. And this is when people act in ways when they're not really themselves. And even a little bit of amygdala activation will result in some suppression of those upper cortical areas of the brain. And when that happens, it makes it more difficult to reason through things rationally, to problem solve, to set goals effectively, and to think straight even. So we see that with clients with anxiety and depression or a history of trauma. They are likely to have issues if their sessions in the therapy room require them to think rationally and consciously, if their amygdala is activated. If someone has anxiety, the baseline setting of the amygdala, even if nothing else is going on, it's set high, maybe too high. And then we also have it being too sensitive, whereby it's not proportionate to the actual level of threat. It's not matching its environment accurately. So as clinicians, we need to be sure to know this and not therefore, leap straight into cognitive processes and interventions, as those upper regions of the brain and the prefrontal cortex in particular that are required for that cognitive approach may simply not be as accessible or even accessible at all, as we need them to be for that approach to be effective. So, in order to calm the amygdala down, we look at somatic, body-based exercises, breathing-based exercises, relaxation-based exercises, and, techniques that induce, a relaxation response or a soothing, calming response in the body. Quality hypnosis interventions, relaxation, acceptance, mindfulness, all offer, a range of approaches for that. And those responses, they won't necessarily help everything. The desensitization that we do is great at bringing down the amygdala's activation when it is activated. What it's not so good for is preventing the amygdala from activating in the first place. And this is why we need an understanding of the other regions of the brain also to inform our treatment plan and be effective.